Hey, so I just wanted to give an update since I finished chemo and started radiation about 2 weeks ago. Um, Everything's going okay. It's getting kind of old driving there 5 days a week and working too. So I usually, half the week I work like 2 in the afternoon to 10 at night. So the next morning after that is not as bad to go to radiation at 11. I just stay up and I go, and then I'll go to sleep. And um, it's not like I haven't slept that night because I get off at 10, so I sleep all night. I'll sleep in a little bit. I'll get up and go to radiation and come home, do my chores or cook dinner or whatever, and lay my clothes out for work, and I'll go to bed. And I'll get up about an hour before work and eat dinner and put my clothes on, take a shower, put clothes on, and I'll go to work. But Friday night, Saturday night, and Sunday night, I work 10 o'clock at night to 7 in the morning. So Monday mornings, I'm pretty tired from working all night. And then I have to wait until 11 in the morning to go to radiation. And that takes like, I think, 48 minutes from the time I walk in until the time I walk out. 58, 48. So that's pretty tiring. So then I get home Monday after radiation and I sleep all day, all night. Tuesday I'm off work every week too, so I'll sleep a lot Tuesday and try to do chores and cook dinner. I'm having a lot of fatigue. I don't know if that's from the radiation itself or from working and doing radiation and just going back and forth and such. Um, my skin is a little irritated. It's not painful yet, but it's irritating. Kind of like a mild sunburn so far. I'm a little red. Um, I asked my radiation doctor how far up the radiation is going. And it actually, surprisingly, it goes all the way up to here. And then down. And so I should be rubbing Aquaphor lotion into up here and all the way up to my neck and all the way down to about right here. And then it goes down to about right here on my stomach and all the way around up under my armpit and all that. So that's where I get the radiation. It's quick, painless. The only thing is they have you hold your arms up, both of them, way high up here, and grab this little handle to keep you from moving. And so I have to have an x-ray before every radiation treatment, and that takes about 5 minutes. And then my actual treatments take 15. So for about 20, 22 minutes, I am with my arms up in the air. So halfway through treatment, my shoulders just kill me. They ache so bad. And these muscles right here, back behind my neck, and my hands and my whole arms go numb. So numb that it hurts. And then about the time that I start getting feeling back in my hands, about a minute after that, my radiation stops. So they've recently started giving me a countdown. Like, you have 5 minutes left, you have 3 minutes left, you have 2 minutes left, last 30 seconds, which is great because the last 5 minutes with all that pain in my shoulder and the numbness, I get real panicky and I get to almost, saying at that point, I have to stop. I can't hold this position any longer. I have to stop. And
So I've learned about the time that I feel like I have to stop and I can't go anymore. If I just wait about a minute 30 seconds more, I'm done. So I've gotten that down. Today's treatment, my arms didn't even go numb. So that was really great. I had a pretty weird episode in the dressing room. I was actually getting dressed after my last treatment, not today. And some little old lady that was a patient, and I'm behind a curtain, you pull the curtain and you're in there, and there's lockers. There's multiple lockers. There's only room for one person in there, and plus you're naked. So I had this little old lady say from the other side of the curtain, I need my clothes. Well, I'm just about to say, and then I hear another lady who's there with the patient say, well, we're all women. Just go in there. Well, I'm about to say, I'll be out in just a moment, because in my opinion, if I wanted everybody to see my naked body and my scars, I would have left the curtain open. It's not like a locker room, This is a medical facility, and we're getting medical treatments for different conditions, different cancers, different places. We all have different scars. I'm just recently out in November or October, so it's been 2 months since I had surgery, double mastectomy. So I have big scars, and I'm just not ready to show my body yet. So just about the time that I was ready, or getting ready to say, I'll be out in just a moment, the lady flings the curtain open, fully open, and stares at me until I get dressed. I was completely in shock, and I'm not one for conflict. I hate conflict. So I didn't say anything that day, and it really bothered me. So the next day when I went to radiation, I told the radiation nurse, and she was just mortified. So they've actually put up a plaque because of this situation. One person per dressing room. If somebody's in there, wait your turn, which you would think is common sense, and you wouldn't have to put that stuff up, but they actually had to put it up. So that was fun. So anyways, that's all I have for now. I'll update you if anything else changes. Thanks.